Good afternoon. And today, first of all, I'm very pleased to interview my neighbor, Alexandra Giselle. She is a nutritionist, and we're going to talk about food as personalized medicine. Good afternoon, Alexandra.
Good afternoon, doctor. It's nice to meet you and see that neighboring practice right next door. I mean, we're so close together, being able to work like that and being able for our patients to have the best nutrition, as well as working with sleep apnea, works hand in hand.
Yes. Uh, so I want to tell a little story about this interview. And we're now doing it in a brand new studio. I revamped the studio. So, because of my book Breathless was released, and significant part of that story really tie up with food. My heroes, or I would say two heroes out of three, really suffer from fast food addiction, struggling with weight, and seeing that in a practice every single day. And having this, I cannot have a full conversation. I'm not a nutritionist like Alexandra, but I feel very compassionate because struggle with the weight is my struggle as well. So today we're going to talk about the topic, hot topic. Should someone with diabetes be totally different than someone with heart disease or suffering, if they're suffering from obesity, or very fashionable medications nowadays called GLP-1? Should they know something before starting this therapy? So it's a real therapy. It's not just, kind of
Not a
vitamin they're taking, right? And we're going to talk about special disease meal planning and weight management, and also it's not as hot now with GLP-1, but a lot of people want to do bariatric surgery. So
Mhm.
what does it mean, bariatric nutrition? And another hot question, if insurance covers this service, because people have no clue how it's addressed from the standpoint of finance.
Mhm.
So while we are all trying to lose weight and manage chronic condition, or simply making healthier food choices without giving up the meals we love. So this interview offers the practical, evidence-based guidance from registered dietitian. And yes, it's true, Alexandra and this wonderful nutritional office is across the street from us. And I'm very honored to work with them or recommend them to my patients. This way, they feel supported while they're going on their sleep, weight, health journey.
Absolutely.
And
Yep.
my first question to you, if people still believe that there is one perfect diet, but it's true, you know, talking to Victor and looking through your website, what you design totally different plans for diabetes and gastrointestinal disorders and bariatric patients, people who are making GLP-1 choices. What does personalized nutrition mean? And can you give us some examples?
Yeah, absolutely. I think as a whole nowadays, that single perfect diet, that one size fits all diet is such a myth in modern medicine, right? For decades, we've been treating patients in human nutrition as a standardized math equation, right? If we do A plus B, C is going to happen. And our biology doesn't work like that. And one person's biology is completely different from another person's biology when you look at that. So when we look at nutrition, we're looking at the person as a whole. And even for someone with just diabetes or having any of the GI disorders, even that has to be specialized to an extent, right? Someone take that has a GI disorder or irritable bowel syndrome or Crohn's. If I take that high fiber diet and I put them on a high fiber diet with raw veggies that we think are all healthy, they can end up in the hospital or in the emergency room with a huge flare, right? Whereas someone with heart disease needs that high fiber diet because that fiber in the diet is going to help them with with their overall heart health. And then if we look at that same patient with diabetes, right? They struggle with insulin sensitivity. So those patients that have my GI disorders, I might be putting them on more of a regular bread or a regular pasta because that's going to help with their flares. But someone with type 1 or type 2 diabetes has a bigger insulin sensitivity, and that doesn't cross. So their insulin goes up where they need to have a higher protein, higher fat with a higher fiber type of carbohydrate to keep their blood sugars level, right? And then going into that GLP-1, and even with the bariatric surgery that we work with just as well, those people have changed their transit time of their digestion. So the food takes so much longer to hit their stomach, and they can't hold large volumes of food. So if I give them that genetic meal plan of, okay, eat this much protein, this much fat, and this much carbohydrate, it may not work for the effects that we're looking for, right? And just overall body type. A patient that is 6 foot in my practice is going to be eating a little bit more protein than my patients that are 5 foot, right? Because it's all about that medical composition of what your body actually needs. So no, there's no one size fits all diet. That personalized meal plan comes in, and that's what we do so much in our practice. We look at all the entities. I have patients that have diabetes, high cholesterol, and then decide to go on a GLP-1 medication all in the same transit. And taking that and having to personalize that meal plan, we have to do our calculations like a math equation, but then personalize it to what's going to work and fit best for them to accomplish their goals.
This is very, very complicated. Like my head, my ears have stand
It's
still.
it
Yes,
goes
yes,
into
yes.
it's a lot more than we realize as we go into it, because we think everything is healthy or not healthy, right? And just like I said, my GI patients look at me like I'm crazy sometimes when I tell them to eat white bread. But the moment they start doing that because they want to have a little bread in their life, they start feeling better because they took out that extra fiber that their body doesn't need.
Actually, that's a new information for me about the fibers and gel. Like I never realized. And the truth is, most of, not most, a lot of my patients, they have a combination of cardiovascular disease and diabetes and, irritable bowel syndrome all at once.
Yep.
So, you're talking about, you can eat fibers. No, you cannot eat, carbs. You need to eat protein, but you can't, and then they go on GLP-1.
Mm-hmm.
And then it's like, but my question to you, it's a personalized question. I'm having a very hard time counting my calories. That's become such a meticulous job, and I really don't like to put restrictions for me. So, what do you recommend somebody like me?
You, doctor, I missed you a little bit there. You said your polyps.
No, counting calories. A
Okay,
lot of people have troubles just like me
there we go.
counting
Perfect.
calories.
I misheard what you said there. I heard polyps, and I'm like, okay, let me go back. So a lot of the times, and this is the one thing I also tell my patients, it's not just about counting calories. It's about, am I getting enough of our macronutrients for my body type, right? And I can give an example. I just had a patient right before talking to you that asked me how many calories are in a protein shake, right? But I said, we're not looking at the calories. 100 calories are in our lovely gram of Twizzlers, right? But there's about 25 grams of sugar in that same 100 calories. So we don't necessarily want to look consistently at calories because that becomes another job that makes it a little bit harder. We want to look at, am I measuring my protein right? Am I doing the portions for what's best for my body, right? If 4 ounces of protein still makes me hungry, let me increase that to 5. Am I getting that balance in a plate? Am I getting a colorful vegetable on my plate? Am I getting some fiber, whether that's from brown rice or whether that's from beans and lentils? Am I throwing that onto my plate as well? And does my plate match that look? That's really what it comes down to a lot of the times. Calories are great, but what I tell my patients is that if you're watching those portions and watching the food you're putting on, your calories are going to match, right? And that's where the personalization comes in. At least in our company, we do the hard work. We do the calculations. We kind of figure out where you need to be, and we provide you the portions of what you need to do. So if you have your portions, you know, okay, if I don't want chicken and I want fish today, I can switch that up and I'll have everything in place. So it really comes down to more getting a full balance in your meal than just that strict portion or that strict caloric control that we always say.
I have a, I was really surprised looking at your Instagram feed. When you put, and I recommend all my listeners to take a look at the visual, representation of maybe 13 chips and a huge, mountain of popcorn.
Yep.
That, you know, food is so much more than just calories. It's a memories. And it's
Exactly.
a lot of emotions. It's a relaxation. So I was surprised looking at certain food and seeing amount of sugar in it.
Yep.
So can you tell me about the food what really everybody claim to be healthy, but actually it's not?
So I think the best way that we can put foods that we claim to be healthy, but actually are not, comes a lot from, unfortunately, marketing. When we look at the marketing of foods, right? One of my prime examples is that the country nowadays looks at protein as the number one source, and we have to have protein, which is true, but we want natural proteins. So we see all of these items out there nowadays, like protein chips and protein pancakes and protein waffles. But, and especially when I tell my patients, they look good in theory, but we haven't looked at what's in them on the back. So those same protein waffles have more fat in them than we might want to eat, and it's going to be more of that saturated fat to make them taste good. So all of these keto brands and all of these high protein items that we see that aren't whole foods, the marketing says they're healthy, but in reality, they're probably filled with more sugar than you realize, and they're filled with more fats than you realize. And that unbalance there leaves us to, with something to be expected, right? So those are one of those areas that we just don't realize. The other area that I find that's very interesting, we always think that if you do sugar in the raw or honey or coconut sugar, it's healthy and natural, and that's what people see. But our body doesn't realize that sugar it doesn't matter what kind of sugar it is, our body sees sugar is the same. So we can eat as much fruit as we want because we think it's healthy. But if we're not doing that portion control, that moderation, even in fruit, it's almost like eating a chocolate bar because our body doesn't recognize sugar in any different way. It's all about what you add to your foods and making sure you're getting those whole foods to the best extent.
Like whole foods, I want you to uh, kind of formula of the whole food. What does it mean, whole food? Yeah, I know it sounds very stupid as a question, but what does whole food mean?
Good question. Whole foods are going to be foods that we see in the easiest sense in the produce section of our food store, right? They don't have anything else to them. So a plain piece of chicken that you're going to see is going to be a whole food, right? Broccoli sitting in the produce section is going to be a whole food. So something that doesn't have all these other ingredients in it, it is a single entity of a food, right? That is what it comes down to. It is not something that has all of these other parts to it. It doesn't have, that extra carbohydrate in there. It doesn't have that extra sugar thrown into it. It is just that natural form of a food. And that's what a whole food is. And that's what we really look at. So the best example that I can give with that is protein shakes. We all rely on protein shakes. Me, myself, sometimes I'm doing a protein shake in the morning to get something in. But if you ask me what's going to be a better option, I'm going to tell you the 2 whole eggs that I would eat compared to that protein shake, because the protein shake has a lot more to it than just those 2 eggs that our body can digest so much better.
I love it. I love it. I'm always going to think about those 2 eggs for breakfast rather than
Something quick and easy, right? We always think, and again, I'm always realistic about nutrition. I drink protein shakes as well. If I'm on the go, I'm a mother of a 2-year-old, I don't have the time, I'm going to grab that protein shake. But if I have the time and I'm knowledgeable, I'm going to put those 2 eggs on the stove, or I'm going to boil them the night before so I can eat them on the go, because it's going to be a better breakfast for me than that protein shake.
I'm going to ask you a very lifelike question about insurance coverage. Number one part of the question, who should see the nutritionist? And number two, what insurance gonna say about?
Good question. So, if you want my honest opinion, I feel like everyone should see a nutritionist, even if it's once in their life, to understand and learn about eating. But in reality, anyone that's struggling with any comorbidities, if you are feeling like you're a little bit overweight, if you have diabetes, if you have heart disease, right? If you're even in the first parts of this, or you feel like you have a family history of it, going to see a dietitian, and mind you, I'm saying dietitian, and I'm going to explain that in a second. Going to see a registered dietitian will help you, because most insurances, almost all insurances, cover preventative care for nutrition. So if you feel like you're at a loss of how to eat your foods or be able to balance your foods, go see a dietitian. When it comes to insurance, insurances cover at 50 to 100% of all nutritional visits because they're considered preventative care. But a lot of people don't realize that. And the reason they don't realize it is because, one, they call us nutritionists. So when they call their insurance companies to figure it out, they say, do you cover nutrition visits or nutritionists? And most insurance companies will say no, because the nutritionist could be your friend Sally down the street, because anyone can call themselves a nutritionist. But registered dietitians themselves are people that have gone through schooling. We've gone through internships, and we actually nowadays also have to have a master's in order to practice nutrition. So we're considered professionals. So we have the qualifications to be able to see patients, and insurance covers registered dietitian visits. For private insurances, you get, I believe, depending on your insurance, at least 3 to 4 visits a year, sometimes more. For anyone that has Medicaid, they have unlimited nutrition visits because it's considered preventative medicine, right? So I always tell my patients, or anyone, my uncle down the street, or my uncle just told me, okay, my primary started me on a GLP-1 and said, good luck. What do I do? I said, go see a dietitian. I said, call your insurance company, which is what I would recommend everyone. Call your insurance company. Ask them about nutritional visits, right? How many nutritional preventative visits do you get a year? And then they'll even help you and give you who's in your area and who's covered. So they do all the hard work for you. All you have to do is call your insurance company, but ask for registered dietitians, because if you say nutritionist, they're going to tell you they don't cover them.
No, this is a great advice, and I do have a lot of patients on GLP-1, and I would just, refer to this advice from you. I'm gonna ask them to check with the food because people don't realize how serious this medication is.
Yeah, it's crazy. They don't realize what it really does to your body. And primary care doctors are the biggest component of this. A lot of primary care doctors, I get patients coming to me who their primary care's prescribed it, and now they're trying to figure out what to do on their own, and then decided a dietitian might be the best way to go.
But I want you to educate my audience and my patients what exactly GLP-1 medication does and how you should change your nutrition, with registered dietitian uh, when you're taking GLP-1.
Yep. So I start with this is that a GLP-1 medication was originally made for people with diabetes to help with their blood sugar control, right? But what we've learned is that the GLP-1 medication triggers our insulin release by slowing down our digestion in the most basic terms, right? By taking that GLP-1 hormone and increasing it in your body. So that's literally, it's called a glucagon like peptide type 1. And that's what that fancy term is. But that's a hormone in your body that helps trigger more insulin release by taking anything that we eat and slowing that digestion so our insulin has time to hit it. And our insulin has time to open that cell to help keep our blood sugars as stable as possible, right? How that works for weight loss is because that food is slowed down, it curbs our appetite and keeps us full for longer because it has a slower transit time. And because of that, we start to eat and portion out our food a little bit differently, right? But here's the thing, and this is what everyone, at least a lot of people believe, is that the medication helps them not eat so that they can eat whatever they want in small amounts or starve themselves to lose the weight quickly. But that's not what we want to do. We want to take those smaller portions and make sure that every bite we eat is nutritionally beneficial, right? So that's the difference between just, watching our behavior changes or going on a GLP-1 and really having to be so much more mindful about the foods that we eat since our body won't allow us to digest as much.
Got it. I got it. And my last question about bariatric surgery.
Yeah.
What your, I know or at least when I spoke to Victor, that was your biggest start when you start helping people with bariatric surgery. I know it's a little bit less popular now, but everything goes in waves, so we don't know how it's going to be. How you change the nutrition for people who have bariatric surgery done, because at least in my practice, I observe a lot of failures. They very happy when they get bariatric surgery done and they get to the body they want, but years pass by and everything stretches, just like a stomach. And then I see everything coming. So how with your bariatric surgery management, it can be also GLP-1 management in that sense to prevent the failures after a lot of money and effort invested into that.
Yeah. Good question. I'll start with yes, bariatric surgery is a lot more down now because of these GLP-1 medications. And it's funny, me and Victor actually had this conversation last week. When it comes to the bariatric surgery, I actually sometimes still like the surgery better. And the reason for that, which is what we don't realize, and I'll get into the why the nutrition plays a part in that, it's because that's more set. That's more of a lifelong. And what we don't realize is that insurance covers it. So instead of going on these medications that are so expensive, my patients tend to go off the medications once they hit that number that they think they want to see. And because it's so expensive still, they tend to gain the weight back a lot quicker because they don't continue with making those dietary changes. And the same holds true for bariatric surgery, but my bariatric patients see me 2-3 years post to make sure that we're keeping up with them. And one of the things that I tell all of my patients that get the bariatric surgery done is that it is the most powerful tool we have to get us back to that metabolic baseline. But it does have a date of expiration. So for the first 12 to 18 months, our anatomy does the heavy lifting. our hunger hormones and ghrelin drop. The physical restrictions are still 1,000% going to be there, right? Which forces our portion control. But unless, just like that GLP-1, we develop lifelong habits to control our muscle formation, to maintain that stomach size, our lifelong habits that may be negative can take over again. And it's the same concept with that GLP-1. The patients that I see, as we said, set those failures up, aren't continuing with that life. They believe that either one, the GLP-1 or the bariatric surgery, are a quick fix, right? That they can go eat 2 chickens from McDonald's because it's not a lot, right? Because it's all they can fit, instead of saying, okay, let me get a piece of that grilled chicken on top of getting a little bit of maybe that vegetable that my body still needs. They're not willing to look at that lifelong habit. So my patients that aren't successful are eating a little bit more, going for more and looking for more of those chips or those cookies or those crackers, because the surgery and even the medication doesn't stop us from being able to graze, right? We can have 3 or 4 pistachios here. We can have 3 or 4 saltine crackers here because they slide through. And that can add our calories up to being 3,000 calories a day, right? Where we don't look at calories, but they're not nutritionally dense calories, right? They're these slider foods, these higher sugar foods. And that grazing plays a huge part. They're not willing to understand that change. Now, that's not to mean that you can never go eat a slice of pizza or have a little bit of pasta, right? Because diet should never be restriction. But they're not understanding that getting those whole foods in, maintaining a schedule of 3 meals a day, because that doesn't work for their system, is important. And because of that, our muscle tone goes down. When it comes to the surgery, we focus, number one, for bariatric patients and GLP-1 patients, whole proteins, right? If you can't do 3 meals a day, I always say 1 protein shake for a meal is fine. Is it my favorite? But I'm realistic about, lifestyle changes. But those other 2 meals, our protein comes first. We're getting those full proteins in, so our body's getting the highest biological value. Are we getting at least a half a cup of vegetables in there? It doesn't have to be broccoli and spinach and cauliflower, and it doesn't have to be cooked. It could be as simple as having some cucumbers cut up on the side to get that extra fiber that our body needs. And are we doing that balance consistently? So that way, 3 years down the line, if I want to have that 1 scoop of rice, I can, because my digestion is slowed from everything else. And that's how we teach our patients, is that moderation is key. Eating and, scheduled is very key. Doesn't mean you can't go off course every once in a while, but knowing how to come back on. And that's where I see most of the failures, is that they think this is that quick fix, so they can go eat all those other things they want because they're lesser portions. And that's the biggest.
Thank you very much, Alexandra. I really hope our conversation inspire a lot of people look at nutrition differently and visit the registered dietitian, and we're going to put your information underneath this interview. Thank you.
Absolutely. Thank you.